As we've been talking about this afternoon, a vaccine for children between the ages of 5 and 11 could be available as soon as Halloween.
And currently the Pfizer vaccine is only available for kids 12 and older. And joining us now to talk a little bit more about the announcement is Dr. Mark Sawyer. He's an infectious disease specialist at Rady Children's. Hi, doctor. Thank you so much for joining us today. We appreciate your time.
It's great to join you.
What did Pfizer's study show exactly, and is the dosage safe?
Well, I don't think we have the complete answer to that yet. We basically have the media coverage of what Pfizer chose to release. It looked very encouraging, though, as if the vaccine, number one, works just as well in children as it does in adults. And secondly, that there were no new or unusual side effects. But as it goes through the whole FDA and CDC approval process, we'll see all of the detail and make sure that's the case.
Let's talk about the numbers, Dr. Sawyer, as far as kids, because for a long time everybody kind of thought, well, you know, kids aren't affected in the same way when it comes to COVID, but things have changed. Right now, kids make up 1 in 5 new cases, and the Delta variant has sent more kids to the hospital in the past few weeks than ever before. Why do we think that's happening right now?
Well, part of it is just that kids, as you know, haven't been able to be vaccinated, so they're all vulnerable, and a lot of adults have either been vaccinated or gotten the infection, so there's just more opportunity for kids to get sick. We still are not sure the Delta variant is that much more severe than the regular variant, but it's certainly more resistant to the vaccine, which is why booster doses are being considered. But it is absolutely true that kids do get sick with COVID. We've had over 400 deaths in the United States from COVID. We've had dozens of kids in Rady Children's Hospital right here in San Diego.
Well, doctor, we know it's just a matter of time before Pfizer submits the data to the FDA for emergency use authorization. Do you know when they'll do this, and when could the agency actually authorize the vaccine for kids 5 and 11 years of age?
Well, typically it takes several weeks at least after the company submits the information before FDA is ready to make a recommendation. Sometimes they convene their advisory group, which is called the Vaccines and Related Biologics Product Advisory Committee. Sometimes they make the decision internally, but I have no inside information on when the company is actually going to submit the information.
Dr. Sawyer, I want to ask you about the issue of vaccine hesitancy. As we know, that's kind of a big issue that's allowing COVID to continually persist here for the last number of months, even after the vaccine's been available to adults. What do you have to say to parents who might be hesitant and say, my kid's small, they're 5 years old, they're 7, they're 10, they're 11, and they just aren't sure? What kind of information might you be able to pass along to them as far as the importance of getting the vaccine?
Yeah, I think the first thing to say is the reason it's taken so long for the company and FDA to consider vaccination in children is they're going to be extra careful to make sure the vaccine is safe. Since children don't get quite as severely ill when they're infected, we have to make sure, doubly sure, that the vaccine is safe. So that will be something that will be done and be very transparent, and parents will be able to read about that. But I do want to make sure parents are aware that kids are getting sick. We're seeing small outbreaks in schools already here in San Diego. Sports teams are being impacted. And unfortunately, kids are part of the problem. They bring the vaccine home to elderly relatives and family members, and they get really sick. So I think it is important to vaccinate kids. It's going to allow them to get back to their normal activities. And more importantly than that, it's going to help us get out of this pandemic.
It is also worth mentioning the fact that there is some sort of inflammatory syndrome that you've seen actually at Rady's with children who have caught COVID.
Yes, it's called MIS-C. It seems to be pretty unique to children, not seen in adults. This is a late response to something about the way your immune system responds to the virus, and it triggers this overall inflammatory syndrome, and it can affect many organs. And we've seen kids in the intensive care unit at Rady with that problem. So that is among the things that is going to be checked to make sure that the vaccine doesn't trigger that same reaction.
Knowing that they will go through their due process to make sure that it is safe for all the kids out there. And like you said, doctor, kids can get it and they can get sick, but more importantly, not more importantly, but also important here is that they can transfer it on to other people inside their home.